title of this video is what are the outcomes from rotator cuff repair surgery? So this is actually something that we, in our practice, we can answer very clearly because we've tracked our outcomes. We have patient-reported outcomes from a database that we have tracked, that I have tracked since the beginning of my practice. And unfortunately, most surgeons don't do this, and they should, because it's incredibly important for many reasons. Number one, just to get better at what you do. How can you get better as a surgeon if you're not actively tracking your outcomes? I think that we all have a feel for how things are going, but nothing can supplant, a patient actually writing down and giving you outcome scores. That's very, very objective information. So if you look at our data, the most important number for me is something called the SANE score, S-A-N-E, and it's basically a number that I ask patients, what % of normal is your shoulder? And when and I think about pain and function, right? And most patients that are undergoing rotator cuff repair rate their shoulders around 40 to 50% of normal, which is pretty low. That's basically saying like my shoulder is half of what I think it should be from a pain and function standpoint. And when patients are that low, they want something done. And often they've had therapy and injections and things like that, and their shoulder is still 40 to 50% of normal. And then when we operate on them, our average outcomes for, at least for small to medium rotator cuff tears, is 90+% of normal. Right? So 90+% of normal, meaning that I went from my shoulder being 40% of normal to now it's 90%. Now I wish that we could get everybody to 100%, but we're not there yet. We're always shooting for that goal. But there is a big delta or a change in our patient's shoulder. So go and know that if you have a rotator cuff tear, on average, when you look at thousands of patients that we've treated in our databases, and these are my own outcomes too. Looking at what we get after surgery, and this is 6 months to a year after the procedure, on average you're going to get a shoulder that you rate as 90+% of normal, which is way better than what you started with. So the outcomes for rotator cuff repair are excellent. The complication rate is very low overall for the majority of tears, and so I think it really is a great operation that makes a huge positive impact on our patients' lives. And gives them a functional shoulder so they can do the things that they want to do. And that's why people come to see us is, they have this shoulder problem that's keeping them back. They can't sleep. They can't do the things they love to do. They're in constant pain. They're stressed. And we go in there, we fix that problem, and gives them a better life. As simple as that.